good afternoon, everyone, and welcome back for our daily briefing. Today, I'll provide the update on our state COVID-19 metrics, as well as our weekly review of our statewide hospital capacity data on three of our major metrics: hospitalization numbers, ICU numbers, and ventilator availability. First, new cases and new tests, as well as the percentage of tests that were positive over the last 24 hours. Today, we are reporting 2,341 new cases for a state total of 63,840 cases, which includes many individuals who have already recovered. 13,834 new tests were reported over the last 24 hours. That's a statewide positivity rate of 17%, though that looks different at different testing centers and across different demographic groups. Over the last 24 hours, we've also lost another 46 Illinoisans to this virus, a total of 2,662 known fatalities in Illinois since the beginning of this pandemic. May their memories be for a blessing. Now I'll get into a few other metrics, but first I want to remind everyone that snapshots in time alone are not enough to offer a full understanding of where we are, but together they can offer some indication of how things are trending. I'll start with our progression of statewide hospitalization numbers over the last month. That's the total number of both COVID-19 patients in the hospital and assumed COVID-19 patients in the hospital in any condition. So on April 5th, we had 3,680 COVID patients in the hospital. On April 12th, 4,091. On April 19th, 4,599. On April 26th, 4,672. As of midnight last night, May 3rd, that number had reduced to 4,493. I'll also offer the same time series progression for our COVID-occupied ICU beds, and then give you a sense of how many ICU beds are currently available in hospitals around our state by IDPH region. On April 5th, COVID patients occupied 43% of our 2,709 ICU beds. On April 12th, they occupied 39% of 2,991 ICU beds. On April 19th, 40% of 3,134 ICU beds. On April 26th, 34% of 3,631 ICU beds. And as of midnight last night, 33% of our 3,681 ICU beds, which when combined with the ICU beds occupied by non-COVID identified patients, leaves about 933 ICU beds available statewide. Of course, that ICU bed availability looks different in different parts of our state, so let me offer you a sense of that and how it looks by IDPH region. And those regions, by the way, are designated by their interconnected networks of emergency medical services. These are the regions that pre-existed the novel coronavirus. They are, in the Rockford region, 51.5% of ICU beds were available as of midnight, and that's about 86 beds. In the Peoria region, 40.2% of ICU beds were available, and that's about 101 actual beds. In Springfield region, 54.3%, or 82 actual beds. In the Edwardsville region, 27.5%, or 25 actual beds. In the Marion region, 27.5%, or 41 actual beds. In the Champaign region, 44.9%, or 62 actual beds. And in Cook and the Collier counties, In the city of Chicago, 16.9% of ICU beds were available as of midnight. That's 186 actual beds. In the southwest suburbs, 17.9% or 94 actual beds. In the west suburbs, 15.9% or 77 beds. In the northwest suburbs, 38.3% or 152 actual beds. And in the north suburbs, 11.9% or 27 actual beds. Now that's a whole lot of numbers, I know, so I want to remind everyone that if you want to check out our hospital utilization data in your area, you can find that information laid out visually on the IDPH website, dph.illinois.gov. And remember, these numbers fluctuate not just day by day, but hour by hour. Finally, I'll briefly touch on ventilators. Our medical professionals continue to innovate treatments to help patients avoid the need for a ventilator, though this equipment can and has saved lives. It begins a very difficult recovery when people are intubated, and it's no doctor's first choice. That said, we continue to keep our eye trained on the number of Illinoisans with COVID-19 who are on ventilators. And from a statewide standpoint, we've continued to see a slight downward trend on this metric from 29% usage on April 6th, then 25% on April 14th, then 23% on April 26th. And of the 4,493 Illinoisans in the hospital, 763 are on ventilators. And that means 22% of our total ventilator inventory is currently in use by COVID-19 patients. That's a lot lower than we had expected at this point, and it's because of the amazing work that people have done staying at home and following our executive orders. I want to again make a call to our workers in nursing homes, hospitals, clinics, law enforcement, and other frontline occupations to help us stretch our PPE stocks further through the use of our new N95 mask decontamination system that's currently deployed in Waukegan. This is a fully free service, door to door. FedEx and Cardinal Health are handling the transport of masks from facilities to the decontamination site and back. And the U.S. Health and Human Services Department is covering all the costs of using this system. Each mask can be contaminated up to 20 times without experiencing any degradation of filter performance. So I want to encourage facilities that have masks to send them for decontamination to our Waukegan facility. I highly encourage people to take advantage of this equipment that's being provided through IEMA. And again, it's fast, it's free, it will help us help you by freeing up PPE as we're acquiring it from abroad. IEMA is ready to assist with the sign-up process for your facility, and they're available 24/7. To register, these facilities must enroll at www.battelle.org/decon. Again, that's Battelle, battelle.org/decon. DECON. Before we move to press questions, I want to let everybody know that today kicks off Teacher Appreciation Week. Educators have long been a special type of unsung hero, dedicating their lives to giving the next generation the tools they need to build a better world. And now, in this pandemic, millions of teachers have stepped into new roles as meal distributors, as tech support staff, 3D printers, YouTube stars, lesson innovators. They're only human, doing their best to do their jobs and to see their students through an unprecedented situation. And by and large, they've shown us their extraordinary compassion and creativity, and I'm so grateful to them. To all the educators watching, thank you for stepping into a role that you may never have expected that you would need to fill, all the different roles that you're filling right now, and I'm so very grateful to you. If you're not a teacher but you know one, I hope you'll take a moment to thank them today, call them, send them a note online. A few kind words goes an awfully long way, so I would appreciate if you'd reach out to them today. Thank you, and now I'll be happy to take any press questions. Dana.
Hi, Governor. The first one is from my colleague at CBS 2, Chris Ty. Yesterday, the pastor at the church in Lena, Illinois, had services with dozens of people attending. Will Illinois State Police enforce the court ruling next weekend, or will you request the county do something to enforce that order?
We have always asked local law enforcement, local officials to enforce these orders. And the best way to do that, of course, is a reminder to the pastor and to the parishioners that they're putting themselves and others in danger by holding a service like this. The pastor filed suit. That suit failed, and it's because people do have the ability to worship, and we're trying simply to keep people safe during this time of a global pandemic.
So will you urge, I'm sorry if I missed it, will you urge local officials both in Chicago, which was going to bring me to my next question, and in any other county that is defying the gathering, the stay-at-home and the gathering order of no more than 10 people, will you urge authorities to step in and do something more than disperse?
Well, we're asking them to disperse. I mean, that's the most important thing. We just don't want people getting sick. It's not an intention that people will go to jail. I will say, however, that if people are persistently defiant, they can be put in jail. And I'm not suggesting that that's the best answer or the first answer, but it is something that's an option for local law enforcement.
And following up on that, a question from Eric at ABC 7. There were nearly 1,000 CPD dispersals over the weekend, but 0 citations. And you, of course, as you just said, you defer to local authorities. But what's your reaction to that number of dispersals in Chicago? And what do you feel needs to happen? And does it concern you that this could lead to a resurgence if this continues?
It does concern me. And people should really understand that if our numbers flatten and get better, and that's where we seem to be at right now, it's because people have followed the rules. And to the extent people are not following them and gathering in groups, they're going to spread the virus, and they're going to cause us to go back into a previous executive order or a more stringent lockdown than what we've had, if in fact there's a spike of cases as a result of people not following the rules. So again, we want to encourage people to do the right thing. I'm sorry that the police have had to break people up like that. I know that it's attractive when the sun is out for people to go out and gather in groups, but I want to remind everybody that it's a mistake. Right now, the only way that we can defeat this virus, because we have no vaccine and we have no treatment that keeps people out of the hospital. And so the result is the only way we can fight this virus is really by obeying social distancing, obeying the orders that have been put in place.
Would you like to see more citations issued as a deterrent?
That is not something that I prefer. But as I say, if people are being persistently defiant, I do think that local law enforcement needs to step in. But it's up to the mayor and it's up to the local law enforcement to make those decisions.
I'm going to combine a couple of unemployment questions, one from Samantha Chapman at WLS and one from my newsroom. And the bottom line is we're receiving, as I feel I say to you every time I'm here, we're receiving literally dozens of complaints almost every day about people who can't get onto the system. They get kicked off the system. No one answers the phone. They have debit card problems, and you have said, well, we're updating the system, but these folks continue to tell us, well, it doesn't seem like it. So what specifically is being done right now to make sure that the acting director of IDES is doing what he is supposed to do to help these people who are desperate?
Yeah. So let me begin by saying that we obviously are deeply concerned about anybody that is owed unemployment and somehow can't file their claim. That is not something that's intended, and we're certainly trying to work through any problems for people that have been persistently having difficulty. I will say that that the system is, I get the numbers of processed claims every day, and the numbers of people who are being processed every day are very frequently in the tens of thousands, which is vastly more than ever before. In fact, it's a multiple of what even was occurring on a weekly basis and daily basis during the Great Recession of 08-09. So there's an awful lot that's being processed. There's also a multiple of phone lines that are being answered for people who are calling in. It's still not enough. There are some people that call in persistently, have to wait for some time on the phone before they can get a hold of anybody, or because there's a limit to the number of people who can answer phones, they may not get a hold of somebody on a given day. I would encourage everybody to go online. That is how most people are, multiples of people are actually getting through and filing their claims. So that's what I would say. I mean, we're doing I will say that the acting director and everybody that's working at IDS is working overtime to make sure that it's working as best it can, and they are working through. There really isn't a backlog at this point, so people who are having trouble, there's typically an issue with their claim, which I understand they need to use. We have online tools that they can use. Even if they can't sign up online, there's a chat function, there's an ability to message to IDES to let them know what your issue is and have somebody get back to you about it. And I would just say one more thing, sorry.
Yeah.
Dana, just that later this week, we're going to review where we are with unemployment, so you'll have a much better, more holistic view of how we're doing and what we've done to address these issues.
Have you ever thought of having the acting director, Chan, come here so we could ask him directly, questions directly?
I haven't, but, I've been focused, as you know, here, for the most part on the directly addressing the virus.
Of course. Question from Craig Wall at ABC7. Thoughts on people who have been going into Indiana over the past few days for services they can't get here? Your reaction to that?
Again, I think, to the extent that people are not social distancing and accessing services in which, Indiana may have decided that they want to open those things up, understand that there are risks associated with that, and I would discourage people from doing it, but understand that, people are free to do what they want as they may leave the state. I don't control the state of Indiana, and they don't control Illinois, but I'd rather be from here than there.
A question from Marianne Ahern. Even Governor Cuomo today says he's looking at opening regions of New York State on May 15th. Will you consider reopening regions, and if so, what is the criteria? Yeah,
so we'll be talking more about that, but suffice to say that I absolutely think of the state as, we have a lot of different areas of the state, different population densities and so on. The most important thing, though, that I have pointed out to people is to think of the state not in the typical way that you think about regions, but rather about healthcare regions. To think about how many hospital beds, and that's why I talked today about how many hospital beds does a certain percentage availability mean, because a spike in one area that happens to have 25 hospital beds available or 25 ICU beds available, if there's a significant spike in that area, 25 is not a big number. And so what we want to make sure is that we were able to handle a spike, because that's what, potentially could occur if we reopen things too fast. And as to the setting a date, it sounds like another governor set a date for, I will say that it really needs to be based on data and metrics. My guess is, knowing that governor, that he was really talking about hoping that might be a date in which they could do it, but you really need to do this based on the data, and that's what we're following very closely. And I want to open it as fast as anybody does. I just want to make sure that we're doing it in a safe fashion.
Follow-up question.
Yeah.
With that and the data in mind, do we have to wait till May 30th to hear what your phased-in reopening plan is? And could you disclose some of the details before May 30th, or do you plan to?
You don't have to wait till May 30th. We're certainly, we've been thinking about this and working on it for some time now to make sure that we're going to, give people a view into, how and the phases might work and how many phases there are and what would work in each phase.
Okay, sorry, I'm trying
It's
to.
okay.
My pen ran out, so my normal organization method went out the window. Question from Amy Jacobson at WIND Radio. We learned Friday after your press conference that you and Mayor Lightfoot have decided to deconstruct McCormick Place. Has the process already begun physically, and what's the total number of patients who were treated there?
Let's just back up. I want everybody to remember why we built out McCormick Place. Virtually every model that was built for the state of Illinois or about the state of Illinois early on showed that there would be many, many more people who would be hospitalized, depending upon how adherent people would be and to the orders that we put in place, depending upon how strict the orders were, that we could bend that curve, but nobody really knows exactly where we're going to end up here. The fact is that because we haven't had to use the beds, as many beds as we thought, and in fact, most of McCormick Place we haven't yet had to use, that is an indicator of the success that we've had both at issuing the stay-at-home order and at getting people to adhere to it. And I'm very proud of the people of Illinois, the people of Chicago, too, for following that and making that possible. So as it regards, how many patients, I think the total number of patients that have been in there at any time is about 29 or 30. I'll get you the exact number. And thank God for that it's only that number. Again, it was built out for a reason. It wasn't built out because anybody wanted to stop the commerce of conventions at McCormick Place, but rather because we wanted to save people's lives. When will it be deconstructed? Well, we're obviously keeping a portion of it live and working in the event that we have a surge during the next, number of weeks. But our hope is that over after a few weeks from now, the last piece of it, which is actually the most useful piece of it, this is Hall B, which has been designed to have negative pressure in the rooms for more serious COVID patients. That hall would be the last thing that gets taken down.
But has there actually been physical removal of
I
some of the
believe
beds?
so. I know that's the intention, and I haven't seen pictures or gotten an update recently, but that's certainly the intention, that the hall that had 500, the first pictures that everybody saw, which was Hall C, had 500 beds erected in 5 days, because remember, the curve was not bending at that time. And so those are being taken down.
Okay. One more question from Amy Jacobson. There's hundreds of thousands, as we know, of Illinoisans out of work. Many, she says, want to become contract tracers. Where and how do they apply?
Yeah, so we'll be giving that information shortly. We want to make sure that we have a system that's up and running for accepting those applications for contact tracers. We're very much looking forward to building up a workforce of thousands that'll help us.
Another question from Eric at ABC7. Are there any regions of the state where the R0, it's the figure I guess you used to calculate rate of spread, okay, where the R0 is below 1, and if so, what are those areas? And again, as I've asked though, might those areas begin to open before May 30th? But what are those areas?
Yeah, so we aren't doing enough testing across the state now. I want to remind everybody, we're the second most amount of testing among the top most populous states, the top 10 most populous states. So we're doing a lot of testing, but no state is doing enough testing. We need to vastly increase the amount of testing that we're doing, again, even though we're doing a lot. But it takes a lot of testing in order for us to get to an R0 number. But we do have a statewide number because of the number of tests we're doing statewide. That number is down to about 1.2. We're certainly trying to keep track of what's happening in each and every region so that as things are coming down, more things can be opened up.
A question from Greg Bishop at Center Square. Is reopening the state's economy conditional on the implementation of a mandatory tracing program, or for the mandatory tracing program to be completed? And if so, how long is that anticipated to take?
I'm not sure what Greg means by a mandatory tracing program, but the tracing program, the contact tracing program, is being worked on and built up. Its completion is not a precondition to phases, but contact tracing is critically important for certain industries, especially to make sure that if people can't maintain social distance in some circumstance, then it's a situation in which, we would need a lot more contact tracing, for that kind of an industry to make sure that people aren't spreading it asymptomatically. So I understand the question. It's not a mandatory contact tracing program, but it is a program that will help us to diminish the spread, and we are trying to spin it up as fast as possible.
Another question from Greg. What's your recommendation for local governments eyeing revenue losses? Should they be laying off staff and cutting budgets now, or should they follow the state's example of no furloughs and no immediate cuts?
Well, I think a lot of assumptions in there. I'm not going to tell local governments what they should do to meet their budget requirements, but what I am doing is working hard to make sure that in Washington that they understand the damage that's been done to all the states and to all of the local governments, and particularly smaller local governments, which really didn't get very much out of a previous CARES Act. We need to make sure that we're helping them so that they don't. Remember, it's easy to say, well, gee, you should furlough a lot of people in order to deal with their budget problem. But remember what happens in a pandemic like this. We have a decreasing amount of revenue coming in and an increasing need by people for the services that states and local governments offer. And that's why we need help from the federal government to preserve those services.
From Barb Markoff at ABC7, one of the plans being floated to reopen the country is to pivot our focus on protecting everyone to focusing on the most vulnerable. Is that something that you are considering as we continue to proceed throughout the month of May?
Well, we are protecting everybody. Everybody's life is valuable, and but I will say that that we already are making extra effort for those communities that are most vulnerable. You've heard a lot about what we're trying to do to protect people in congregate settings, which are often the most vulnerable, right? These are people who are physically or developmentally disabled. They're people who are elderly and may have other existing underlying conditions. You've seen that we've spun up more testing in areas where there are large African American populations or large Latino populations, which have a propensity to have comorbidities or a higher rate of positivity. So we're working on those populations that are most vulnerable even now, and we'll continue to do that as we begin to open things up.
And I think what you meant was, might there be a shift as we move forward from the stay-at-home for all to making sure we focus on the most vulnerable only as a part of a reopening?
Well, sure. I mean, I think we're shifting. I mean, that shift, when you say shift, I mean, I'm not going to shift away from protecting everybody, but this idea of shifting the stay at home and saying only these people have to stay home, I guess that's everything is evolving. That's what I would say. And obviously, at some point, we're not going to have the same order in place that we have now, and we're going to be loosening things up. But as we do that, we're going to be still paying extraordinary attention to those who are elderly and in these congregate settings. I didn't mention, of course, the staffs in those settings, and even in our prisons, the staffs in our prisons as well.
Question, it circles back to McCormick Place from Charlie Wojciechowski at NBC5. Regarding McCormick Place, was it too much too soon or a necessary precaution?
It's interesting if you go back to the day that we talked about the stay-at-home order on March 20th, and Dr. Emily Landon stood here. She said the most remarkable thing about the success of a stay-at-home order is that nothing happens. And that's really, this is a function of, guess what? A lot of people didn't get sick and a lot of people didn't die. And so that's what it means that we have, that we spun it up, because at the time we didn't know whether we'd be bending the curve. properly. And it turns out we have. And so thank goodness. And I said early on, my prayer is that we won't have to use McCormick Place or any of the alternate care facilities. And it's still my prayer. People, I want everybody to understand, we're not through this yet. We're not done with this. The virus didn't go away. It's still out there.
There are some wondering where Dr. Ezeki is today.
She had a family matter, so she's with them.
Well, I will ask you this last question from Marianne Ahern. It was for the doctor, but there are health regions with low positivity rates. You've touched on this. Do you recommend reopening those regions?
Yeah, again, those are going to be pieces of, how we think about each region and what can open. So thank you. Yeah.
Thank you.
Okay. Hannah at the Daily Line. According to movement tracking data from Google, most of the stay-at-home behavior changes asked of Illinoisans, like not going into workplaces, avoiding public transit, going to grocery stores as little as possible, already happened in early March. If social behavior is now on the rise because of warmer weather and loosened restrictions in the new stay-at-home order, and Illinois' R-naught value is still above 1, how can we be sure we will ever get to an R-naught value below 1?
Other places that have put in a stay-at-home order have gotten to an R-naught value under 1. We've headed in the right direction. We're moving in the right direction still. And as to the point about the R-naught starting to move, or people are being less mobile, let's say in early March, I'd just point out that the news about coronavirus was out there. Remember that some of the first moves that we made in the state of Illinois occurred in early March, in the first week and a half of March. And so people began to see that this virus is out there, that people are getting sick, and I think they reacted naturally to that. And then I think that's evidence, by the way, of how smart people are in our state, and the fact that people have followed the stay-at-home order is other evidence of how terrific the people of Illinois are.
There's legislation being introduced in the General Assembly that would cancel rent for those who cannot pay, subject to the establishment of a housing relief fund that would, in theory, mostly be paid for by a second federal stimulus bill. Is this something you would think Is this something you think would be wise to count on from Congress? Is there anything the state can do proactively, either through state police or the Attorney General, to prevent landlords who are ignoring the moratorium on evictions and evicting tenants?
I'm not aware of the specific piece of legislation that's being referenced here, but I am very much in favor of alleviating the burden on renters across the state. It is true that Illinois, the budget situation for Illinois makes it extraordinarily difficult to provide a lot of relief, but we do have rent relief programs at the Department of Human Services, and we do want to do as much as we can with the federal dollars that we receive to alleviate the burden, particularly on working class families.
This is from Rich Miller at Capital Facts. He's asking for your reaction to the Illinois Trial Lawyers Association warning that municipalities and businesses that reopen in defiance of the EO could face litigation, and also your reaction to the Illinois Department of Insurance statement that says businesses run the risk that an insurer could find reason within the policy language to deny COVID-19 related claims. What could potentially happen to state licensed businesses if they reopen in defiance of the EO?
Well, I was a businessman before I became governor, and I have to tell you that I would not want to defy the executive order because I believe that I would be taking on liability if I did that.
This is from Carter, WAND in Decatur. Governor, the mayor of East Peoria announced today that he is opening the city in phases starting this Friday, and it will include salons. This goes against the stay-at-home order and the recommendations of IDPH. Is there concern that this could cause more cases? Will the state step in and prevent this? What about people traveling from nearby communities and then returning home?
Yes, if East Peoria is opening, some of the businesses in East Peoria are opening, I think they're running the risk that they're going to infect people who work there, infect people who patronize their stores, and in defiance of this stay-at-home order, it strikes me the point that we were just talking about insurance not covering you when you may have business insurance, but you will be subject to liability, because it would not surprise me if insurance companies are found to not be required to cover you when you are defying essentially state law or a state executive order.
Sam at NPR Illinois, Companies like Apple and Google have volunteered their tech to help with contact tracing. Has your office been in contact with any reps, and do you have any privacy concerns in enlisting their help?
So I'm very much aware. I think some of you know when I was in business, I was in the technology business, so I've followed it pretty closely. And I'll just say, we're looking at the technology that's being proposed. It poses some questions about privacy. It's not something that we're currently looking at as part of the program that we're building for contact tracing, but I'll want to see more as the technology is presented and developed.
Hannah at Block Club, based on what we saw this weekend, people are expanding their quarantine circles. What advice do you have for people who want to do this? Is seeing young, healthy family okay? What about grandparents, or should people absolutely avoid this at all costs?
I'm sorry, is the question that families are getting together and quarantining together weren't?
I think it's that people are expanding the people that they're seeing. So would you say that seeing your healthy family members is okay?
No. So I just will remind everybody again, and this is, I think we all know, we've been in this situation for about 7 weeks now. I'm not sure how many weeks, since March 21st. For a little while longer, it's very important that people who are asymptomatic, you feel fine, but that you stay away from people who you have not already been in close contact with, and that you not quarantine together with them, because just because you are asymptomatic does not mean that you do not have coronavirus. And so again, for a little while longer, as we await the development of a treatment, and you saw that one was already approved, although it's only for severe cases, but there are 70 of those being tested by the FDA, or through, looking for approval by the FDA. And so, I would just stay away from your elderly relatives in particular, and don't, quarantine together with people that you haven't already been around.
Jim Haggerty at Rock River Times. Governor, some small businesses have told us they may not survive the economic blow COVID-19 has delivered. Do you foresee any industries in Illinois that will no longer exist because of this crisis?
I don't know, and I'm hopeful that that's not what's happening, but I can see that so many people are suffering. It's why I'm such an advocate of the not just the PPP program, but so many supports for small businesses, because we want people to come back and reopen their doors. We're going to do everything we can in the state to have that happen. Small business people are the bedrock of business, bedrock of job creation in our state, so they deserve our support.
Dave Dahl at WTAX. Governor, we know the Speaker of the House and the President of the Senate call sessions, but you have the power to call a special session. What have you thought about doing that? Why or why not?
Yeah, I think the most important thing is that the legislature gets together safely. And, there's, like I've said before, 177 members of the General Assembly plus staff. That's an awful lot of people. That's more than 10 getting together. And so the epidemiologists, would express concerns about a group that large. Having said that, there are ways to do it. We help to provide support to the legislature as they have asked. How could they do it safely? And we'll continue to do that. We want the legislature to get together, and they have the ability to get together. And we're providing, again, epidemiological advice about how to do their best to keep everybody safe.
Molly Parker at the Southern Illinoisan. Tennessee announced last week that it will begin mass testing of staff and inmates at state prisons. It appears Illinois has only tested about 1% to 2% of inmates. Is this adequate? Will you follow Tennessee's lead and begin widespread testing in prisons and jails?
The more testing we have available to us, the more we will be testing in all those congregate settings. But remember, we also have nursing homes. We also have these developmentally disabled homes and so many other areas that also need testing. So again, it takes a lot more testing than we have today.
Dave McKinney at WBEZ. Can you address the significance of today's death total being the lowest since April 19th? Also, what reaction do you have to Saturday night's federal court ruling in the Beloved Church case?
As to the number of fatalities today, I would just encourage everybody to look at these things on a multi-day basis, taking maybe a 3, 5, or a 7-day average. I'm hopeful. When I saw this number today, I was hopeful that this was the beginning or a continuation of a trend that I've been praying for. So but I think one day is not, a helpful number to look at. As to the ruling in the case of the church, I want to remind everybody that, it's important to get together with your fellow parishioners and your pastor, but we've asked people to do that in groups of 10. We've asked pastors to reach out to their parishioners and try to do that online or get it in small groups, Bible study in a small group, again, socially distant. And we've provided other suggestions of ways that people could get together to have services, but getting together in groups of more than 10, I think I read that there were 60 or 80 people that got together at that one church in defiance of even the U.S. federal court ruling, is an enormous mistake. And I am very hopeful that we aren't going to need to send teams in to do mass testing among the people who may be spreading the virus in their community.
Shia at Politico. Governor, we heard today the mayor is still advocating for a Chicago casino. Do you think that's still a possibility, and what are some options you and the state legislators are considering in making that happen?
Well, I've favored getting that done. I think it's the right thing to do. It may be difficult to do, in the next month. I don't know, in the next few weeks. It depends on when the legislature gets together and how. I will say that, we have a whole year here with which to, for the legislature to get together to handle legislation. And I think as we, again, see more treatments available and as we have testing and tracing and PPE available, it will make it a lot easier for the legislature to get together throughout the year, maybe in one-day increments, just to keep everybody safe, not needing to stay overnight and room together and all of that. But there's a lot of the year here with which to address something like that. And as I understand it, the Republican leaders are in favor. At least I'm aware that the House Republican leader is in favor of that that Chicago casino bill. And I know there are a number of Democrats who are too. So I would hope that we'd be able to get that done in, sometime during the year here.
Dan Petrella at the Tribune will be our last question. How are the occupancy limits at stores being enforced, and how well do you think people are complying with the new face covering requirement after the first few days?
Yeah. It's really just a visual survey about face covering and occupancy of stores. So I don't have an official report of that. But I will say just, as I look outside, as I see people walking on the street or, in small parks or whatever around Chicago, I have seen that I think the numbers seem to me to be about 70 to 80% of people are wearing masks, or they've got a mask with them that don't have on their face because they're not around somebody else. So I think that's pretty good adherence, although I'd love it if everybody would do it. And remember that if you have a mask, you should wear the mask when you're meeting up with people on the street. And even walking by them on the sidewalk, it may seem like, well, gee, I'm just passing by. How could I possibly catch coronavirus by walking by somebody? Well, guess what? Coronavirus can be aerosolized as people cough or breathe or talk, and so it could happen. And so I just suggest that if you're taking a walk down the street and you know that there are other people that are coming toward you on the sidewalk, it's best if all parties are wearing masks and face covering. So thank you very much.